Hi everyone, today I want to discuss about privacy, but before that I want to tell you about case study 1. Case study 1. Privacy. Dr. D was an obstetrics gynecology resident pursuing a joint residency at the State University Medical Center and the Regional Hospital. During an invasive surgical procedure, Dr. D was accidentally cut by the attending physician. The record does not indicate whether there was any actual blood contact between Dr. D and the patient. It appears there was no blood exposure, although no one can be certain. The following day, Dr. D voluntarily submitted to blood testing for the HIV virus. The results confirmed that Dr. D was HIV positive. After being informed of the test results, Dr. D willingly withdrew from participating in further surgical procedures, informed the appropriate official of his condition, and requested a voluntary leave of absence. Upon investigation, the medical center identified 279 patients who had been informed to some degree with Dr. D during the course of their medical treatment. Likewise, the hospital identified 168 patients who had been in contact with Dr. D since the time of his joint residency. Unfortunately, hospital records do not necessarily indicate each time a physician is cut, nor do they specify the distinct role of each physician in a surgical procedure. Thus, every patient with a reasonable chance of exposure to Dr. D was included in the statistic outlined above. Both the medical center and the hospital filed petition alleging a compelling need to disclose information regarding Dr. D's condition to those patients potentially affected by contact with him. In addition, the hospitals believed there was a compelling need to disclose Dr. D's name to the other treating physicians in the department, so that those physicians could contact their patient in the event they had been assisted by Dr. D in any invasive procedure. In response, Dr. D asserted his right to privacy, arguing that no compelling need was tantamount to a justification to disclose his HIV-related information. The problem of this case study is, should the hospitals disclose Dr. D's disease? My answer is no. The hospitals have no right to disclose Dr. D's name to the other treating physicians in the department. Dr. D's right to privacy is not different from that of any other person. Therefore, disclosing Dr. D's name is a severe violation of his right to privacy. In my opinion, the right to privacy is an integral part of inherent right of every human being to dignity. It represents the right of every individual to determine when and how much personal information will be exposed to the public. Every human being has a right to privacy, and thus patients, as well as practitioners, and are entitled to it. This right actually enables individuals to maintain their autonomy and to live as they want. Some countries ground this right in their laws, as stated in Article 9 of the Universal Declaration of Bioethics and Human Rights. The privacy of the persons concerned and the confidentiality of their personal information should be respected. To the greatest extent possible, such information should not be used or disclosed for purposes other than those for which it was collected or consented to. Consistent with international law, in particular international human rights law. But in addition, the public's right to know about incidents that may affect them is also part of their right to dignity. One of the most common practices for balancing the two rights is revealing only the relevant information while avoiding disclosure of names, etc. So that's my answer and my opinion about this case study, and thank you.